here in DC, but we see that folks are still joining, so we're going to give everyone just one more minute or two, and then we'll get started. Hi, everyone. Thank you again for joining the webinar today. We're excited to have you, and we're excited to talk with you. Just a few quick announcements before we get started. First of all, you've likely noticed that you are currently on mute. It's not because we don't want to know what you're thinking. It's because we want to avoid the background noise. So if you have thoughts or questions throughout the webinar, feel free to chat them in. If we have the option at the end and there are any questions that we can answer, then we will give it a shot. But either way, we'll have a record of all of the questions that come in. So do feel free to send those our way. Also, a version of these slides will be made available, and the recording of the webinar will be made available, but we have to make them compliant with the Section 508 of the Americans with Disabilities Act, and so it will probably take us a couple of weeks. We're aiming for early January to get this online. So without further ado, I will hand it over to Shannon Rudisill, the Associate Deputy Assistant Secretary for Early Childhood Development.
Good afternoon, everyone. We are so happy to be with you this afternoon to talk about our new proposed rule to strengthen the child care system. But first, I have to say that it's just been a banner week for early childhood development, and particularly for child care. Here, we've had a very good outcome of the budget agreement that brings about $1 billion new to early childhood programs across ACF, including increases in Head Start, maintenance, plus a small increase in the early Head Start child care partnerships, and also an increase in the Child Care and Development Fund. So this is another great milestone this week to cap it off, to talk with you about the proposed rule that you can see today on display on the website of the Federal Register, and you'll be able to, will be fully published next week. And I think that the first thing to say about this is we really appreciate how much this has been a team effort. And I'm going to talk a little bit about our team here, but we heard loud and clear about a year ago, almost exactly a year ago, not quite, when we were doing many, many webinars just like this. Rachel and I together were doing many, many webinars just like this about the new statute that had passed. We really were not sure that we would be able to get to this point at this time because of the amount of work that it really takes to think these things through and to get to the point where you can propose a regulation, which in fact our amazing Office of Child Care team had already been spending the previous 18 months doing right before the law passed, and we had to sort of go back to square one and get started. But I have to say that it was speaking with many of you around the country, having folks visit us here in Washington, that really not only made us realize what an important step everybody felt this was, but also that you also saw it as a team effort, and that a lot of the research, the analysis, the thinking that you've done and that you've put forward, not just in the past year, but over the past previous years leading up to the law, were assets that we could rely on as we tried to go through to get this done on a really expedited time frame. So we've already had your partnership on this, for which we are grateful, and we know that we will be asking for more partnership for you as we finish out this process over the next year. And then I just have to say about this, Rachel and Andrew Williams, our policy director at the Office of Child Care, and the whole team, most of whom are sitting here with us, not all of whom, but most of whom are sitting here with us today, they're just an incredible team. I cannot tell you, they produce some of the highest quality work in government, period. And we hear that from folks who work, you know, with a lot of folks across the government. And I think that we've managed to assemble in the federal government really the best early childhood team in the country, in a public or a private organization. And it's a tremendous privilege to work with them. And, you know, if you've not been in government, you may not realize what it takes to put out not one, but like 2 regulations, and to withstand one of them sort of being superseded by a law and then starting over. And this team has done it with intelligence and grace and positive attitude, and really amazing. So we just want to acknowledge them. And before I turn it over to Rachel, I want to say a couple of words about that ongoing partnership that I referenced earlier. So the ongoing partnership has to do with this comment period that we're headed into. So you're going to hear Rachel talk to you about some of what's in the proposal, and this is your chance to be formally heard over the next 60 days as you submit comments. And so Rachel will talk to you about some of the additional steps that the team is taking to be sure that we hear from you. But there are a few things to know. Our plan is to get this done, you know, in 2016, and not scrape it by the end of 2016 either, but to really get it done with room to spare. And that means we're going to be reading your comments, taking them seriously, and turning them around on an incredibly short time frame. I'm not quite sure that I've ever seen a time frame with regulation comments as short as the one that we're looking at to get this done. And there are a few things that you can really do to help us. And we absolutely are committed to hearing from you and taking every comment seriously. So a few things that you can do to help us. One, if it's at all possible, you can submit your comments early before the end of the 60 days. Now, I'm saying that cognizant that we're putting this out at holiday time. So, you know, we're not crazy here, but if you happen to be able to get it done before the end of the 60 days, that would be helpful. The other thing that you can do that is really helpful to us, and that we've learned from our experience with the Head Start program performance standards that ACF is also working on right now, is a lot of you, especially those of you on this webinar, membership associations, big stakeholder and advocacy groups, you have the ability to organize people to think about this in an organized fashion. And if you can organize comments and have multiple folks sign on to those comments or participate in some sort of comment process, that really expedites over having everybody send basically a form letter. So I just like to really encourage you to think about that, and think about that role that you could play as a partner to help get people together to sign on to common sets of comments, because they will hold weight. We will look at everybody who signed. We will consider them in the light of the fact that many people maybe, or a few people or whatever, signed on to them. But from a logistics standpoint and helping us analyze and turn it around, that's much easier to deal with in our comment analysis process than having, say, the same 60 people send us a form letter. So I just want to encourage you to think about that. And the last thing about comments that I mentioned the first time we went through this Notice of Proposed Rulemaking process that turned out to be a huge asset, I just want to encourage you, as you read it, think about commenting on things you like as well as things that you don't like. And it's a very large document. I am sure there will be things that people are concerned about, want to comment on. I'm also sure there will be many things that people feel positively about because of the comprehensiveness of the document. And it's a basic human tendency to think that you only need to comment about things that you don't like and you want to see changed in the final. But the way that our comment process works is we're supposed to say things like, many people said X, a few people said Y, right? And so and this doesn't matter what the issue is or what side you're on. If you only comment on things that you don't agree with and would like to see changed in the final, then there will be other people who comment about things they don't like that you actually did like, and we won't have the true view of what the field thinks because we'll only be hearing the negatives and not the positives. So I just want to say we fully know that there'll be folks who have concerns about things and we want to hear them, but don't forget to tell us things that you liked as well, especially if you don't want to see them changed. So with that, I will turn it over to Rachel Schumacher, the Director of the Office of Child Care.
Thank you so much, Shannon. It's so nice to have you here to help introduce this.
and to share your wealth of knowledge and experience going through this exact same process not very long ago. So thank you so much for your introduction and your support as I have been getting to know this process myself this year. Hi, everybody. We're so thrilled to have you on the call right now and to be able to share with you the NPRM. It's been a big lift for everyone here, but we really did hear you and understand that this is something you really wanted. So I hope that you really get a chance to dig into it. Not during the holidays. This webinar is for you to get a glimpse and a little signal of some of the things that are in it. We're going to put out a bunch of resources that will also be maps to help you focus in on the changes and things that should be up very shortly on our website. So we really do, including a red line of the regs. So we hope that helps focus you in on the things you like and things you have some concerns about and want to help us tweak. But we did try to get this out earlier. This is when it's out. So here we go. We're going to share this information with you now, and there will be future chances to talk coming in the new year, which I'll get to in a minute. So everybody knows that Congress passed on a bipartisan basis this law last year, and then it made a lot of changes. And as Shannon referenced, a lot of things in the law actually took a page from years of advocacy and research and things that you had helped bring to folks' attention at the national level, and then went beyond in some other areas. So some things looked really familiar, and some things Congress added in that weren't in what we had been going through with the NPRM before that. They were the things that Congress felt were important to add. This NPRM has to implement the statute and address the statute that was passed, and we really took a lot of serious time thinking about it. I think I had a teacher in 6th grade who used to say, be quick, but be careful. And that's what we tried to do when we were doing this. So it's a historic re-envisioning of the program, and we have a lot of you to thank for that successful passage. And I would be remiss if I didn't also say we're very excited and should thank you for all the efforts folks on this line have probably made to succeed in getting that $326 million in the budget agreement that we're hoping will be passed very shortly. So thank you for that too. So what is an NPRM? By now, everyone on this call probably is quite familiar with what it is, but I always am learning my alphabet soup working in the federal side of things. It's a Notice of Proposed Rulemaking. As Shannon said, it's the opportunity for the public to comment. There will be a 60-day comment period starting from the official Federal Register publishing date, which we have been told will be the 24th of December. And then we will go into our comment period review in a very quick time, and we're hoping to have a final issuance by summer 2016. So what have we been doing? Why did this take so long? What have we been doing? Well, we've been doing a lot of things, but what we wanted to make sure we shared with you are all the types of input we tried to get from people over the last set of months. You certainly know we had a reauthorization webpage. We received questions through our reauthorization email we have over 650 questions that came in through these various ways we were taking in information. We had listening sessions. Some folks on the line probably participated in, and we also held meetings with our state and territory partners, as well as a series of consultations with tribal leaders. In addition, the folks here who were here for the last round probably had deja vu all over again because they had to review the public comments from 2013's NPRM, which we did do because we wanted to remember and take note of where folks were last time around. So I'm going to get into now how we approach doing this. One thing that we have spent a lot of time studying and thinking about was looking at the revised purposes of the Child Care and Development Fund that were added by Congress. The text here that's in bold were the new things. When the law was first created, when the fund was first created,
there was an emphasis really on getting folks to work and child care as a work support, and this new revised statute and what we have in the purposes really reflects a lot of change in the research and understanding of what's important for child care in terms of child development and engaging with families. So you see here one of the revised purposes talks about partnering and promoting involvement of parents and family members in promoting child development. Additional purposes include delivering high quality care, looking at training and oversight being a key component of that, you can see here in bold, and improving the actual child development of participating children and increasing access to the number and percentage of increasing the number and percentage of low-income children in high-quality child care settings, which is a metric familiar to us from Race to the Top Early Learning Challenge, and really something that we took to heart when we were thinking about how to interpret and address the law, is is what we're doing going to meet these purposes, because we took those very seriously. I'm about to share 4 focus areas that are critical to what are in the law and the NPRM, and for ease of explanation, we have them in 4 buckets. One around health and safety, one around consumer choice and family engagement, a third around equal access to stable, high-quality care for low-income children, and a 4th around the all-important enhancing quality of child care and the early childhood workforce. The first section, as I said, is protecting the health and safety of children in child care. And you all know on this line, you're very familiar with the strong interest that, that Congress had in looking at this issue, and very specific provisions with specific deadlines that were put into the law around training, monitoring, and criminal background checks. So first off, let's look at health and safety training and standards. The law requires that states, territories, and tribes put in place training and health and safety requirements related to the specified topics, and there are 10 that were specified in the law for CCDF providers. And taking off from that, we are clarifying a few things that we received a lot of questions about, and these are listed. Some of the highlights are here and listed. The NPRM adds recognition of reporting and child abuse and neglect and child development to the list of required trainings. It also defines pre-service or orientation as being within the first 3 months of starting. We got a lot of questions about what exactly provider meant, and so we clarify that it includes all caregivers, teachers, and directors in the provider setting. And we also named the Caring for Our Children Basics resource that was put out earlier this year, or was it last year? I think it was earlier this year, as a baseline for health and safety standards, saying that this is not required, but that a state would do well to look at these basic standards and to incorporate them into the standards and training that they are putting together to comply with this provision in the law. As was already there, relative providers may still be excluded from health and safety requirements. Let's turn to monitoring. The monitoring requirements in the law, as you know, were in place for licensed, for pre-licensure and annual unannounced inspections, and license-exempt annual inspection of CCDF providers, and these are intended to be in place by November 2016. In the NPRM, we specify that the monitoring must cover the health and safety topics listed on the previous slide. We also clarify that differential monitoring or use of a risk-based approach for annual inspections is an allowable way of meeting this requirement. We know a lot of states have been looking into these approaches and using them to better target their monitoring towards providers who are having a little more trouble meeting requirements rather than the others. And so as long as the content covered by each visit is representative of the full complement of health and safety requirements, and there is still annual inspections as required, they can use a differential monitoring approach. We also encourage coordination with other monitoring entities. I know that we've put out some policy statements and resources from Linda Smith's office around this, We continue to encourage that type of collaboration, to sharing data and information from one monitoring visit with the next, so that a visit builds on what other types of visits have occurred, rather than repeating the same types of collections of information if possible. And we allow the option of developing alternative monitoring requirements for care in the child's home. We have been getting a lot of questions on this. The Congress did not allow an exemption on this, but what we are saying is that it's allowable to come up with alternative methods of monitoring that type of care. We also require, in the NPRM, it requires the child care providers report to a designated state, territorial, or tribal entity any serious injuries or deaths of children occurring in child care. This is something that Congress is very concerned about. They're really looking for more information on health and safety being made available to parents as consumers as soon as possible and as easily understood as possible, so that they can make informed choices. The next section is the criminal background check section. This is one of the most detailed sections of the law. As you know, child care staff members, including prospective staff of all licensed, regulated, and registered child care providers, of all child care providers, and all child care providers eligible to deliver CCDF-funded services must have comprehensive background checks by September 30th, 2017. Congress outlined a specific list of checks. What the NPRM does is clarifies where there were inadvertent overlapping of background check components. So there's a clarification there that our state partners are very happy to see, I'm sure. We also made clear that background checks are required for child care staff and for individuals age 18 or older residing in a family child care home, because they also have unsupervised access to young children. We allow for prospective staff members to provide services to children on a provisional basis as they are supervised while the background checks are being processed. And this is in response to some of the concerns we've had about timing and providers not being able to hire and operate if they can't get someone on board. So this will allow for supervised supervision of those folks so that we can still have children get served as long as that safeguard is in place. And the NPRM also requires states to have policies and procedures to respond in a timely manner to requests from other states, territories, and tribes for background checks results. And this is because, as you are very much aware, the law requires that that you have a check of a prospective or current employee so that it goes back the last 5 years in any state that they've lived in. So this is something that we know our partners are trying to figure out, and we have able folks here working in partnership with our regional folks and states around the country trying to help them work out some of the kinks to make this provision work well for everybody. The next section is around helping parents make informed consumer choices and access information to support child development. We've been it's interesting, many of you know I've been working for a long time on issues around family engagement and two-generation strategies. We're really looking at the consumer education section and trying to think about consumer education as sort of an old-fashioned word for what has really been a trend in the field, and thinking about engaging families and getting to that revised purpose that's in the law around really helping families in engaging them in the development of their children and supporting them. So we've been looking at that a lot, this section with that view. The first piece, though, is around the consumer education website. So you can see from the slide, it's a little hard to read. There's a lot of information on it, but there's a lot of things to share. So the consumer education website provision requires states to have a consumer-friendly and easily accessible website, and it must ensure the widest possible access to services for families who speak languages other than English and persons with disabilities. And some of the things that must be on the website are listed below in the sub-bullets. I'd just like to direct you to the provider-specific monitoring reports, which must have levels of quality if available, and the number of serious injuries and deaths that occurred in that provider for all licensed and CCDF-eligible providers. We're also going to be collecting aggregate data around injuries, deaths, and child abuse and neglect. We are going to, the NPRM also requires that there's information about referral to local child care resource and referral organizations, and directions for parents on who to contact to better understand the information on the website. So there's a lot of provisions in this section that talk about getting information to parents, providers, and the general public. And we've been encouraging people around the country to think about that, because we know, well, nowadays people need to get information a lot of different ways, and they're getting so much information that just posting it on a website may not be enough. But on the other hand, websites and social media are now where a lot of people are getting their information. So we've been working with states thinking about this around the country. It also requires posting full monitoring reports and results for all licensed and CCDF eligible providers in plain language, and including a plain language summary. So that is something that we've been looking at and talking to people around the country, because we know monitoring reports are not always that easy to understand for the average parent, or even anyone, really. So it's not the actual licensor. So we do need to have a way for parents to understand what's in them, so that's why that provision is there. We also recommend and ask for comment about posting those within 90 days. What's a reasonable time frame for getting this type of information up from the point that the actual visit occurs? How quickly should that be available publicly? And we also have some provisions in here which align federal and state websites by including the components that were required at the national website, the childcare.gov, which was authorized by this legislation, to the state website. So we want to make sure that if we're going to have a 50-state equal access to information about how to choose and find childcare, that means we have to make sure that information is standardized across the country. Excuse me. So the next slide is about information for parents and providers to support child development. This includes resources about developmental screenings. This is a provision that was required in the law. What the NPRM does is discuss it a little further by saying that this type of information ought to be made available through the CCDF intake process, because we want those parents to have access to the information, and to providers through training and education. We recommend but do not require all children receive a developmental screening within 45 days of enrollment, which is similar to what is required in the early Head Start programs. We're cognizant that that's not a system that we have the exact same types of resources for. We all are aware that we don't have the same program, but we do make a recommendation around this as an important goal, since we would like to see someday child care participants to have the same access to these types of services, whether or not they are part of the Head Start, early Head Start system. We also have in the NPRM some of the provisions that were included in the law around providing information about states' policies regarding social and emotional health of children, and we clarify that the policies would be related to children birth to age 5. The language in the law said preschool, and we just wanted to clarify that that includes birth to age 5. In addition, there is NPRM language that talks about the law's provision that research and best practices concerning child development and meaningful parent and family engagement need to be provided. Continuing on in consumer education, we also have in the NPRM a provision that is familiar from previous versions to require a provider-specific consumer education statement to be provided to CCDF parents, which must include information on state health and safety policies and procedures. Materials should use plain language and consider the abilities, languages, and literacy levels of the audience. We encourage translation of materials into multiple languages, and to inform persons with disabilities how they can access aids or services that are appropriate for and accessible despite any type of barriers they may have. We also have a little flexibility in here on the definitions of major substantiated complaint, serious injury, and substantiated instance of child abuse and neglect. The next section is around providing equal access to stable, high-quality child care for low-income children. This is a section that also reflected a lot of differences from what Congress put in from what had been previously proposed. So just to remind us all, we have the actual language from the law here about promoting continuity of care. The law requires that each child who receives assistance will be considered to meet all eligibility requirements for such assistance and will receive such assistance for not less than 12 months, regardless of temporary changes in their work or education status, as long as their income is below the federal threshold. Further on, we have the language around the options of states to terminate assistance before the end of that minimum 12-month period, as if they see matters around parents' loss of work or cessation of attendance at a job or training and educational program. So you can read this as well as I can. You've probably been reading it over and over again for the last year. We then went on to, so we read it many, many times too, and then have, we'll go on to share what the NPRM says around addressing these provisions. First off, we clarify that the minimum 12-month eligibility applies to initial and subsequent eligibility periods. The NPRM proposes definitions to temporary to include, at a minimum, some specific conditions, specific time-limited absences from work or school, such as seasonal work or a school break, reductions in work, training, or education hours, and other changes to work, education, job training status that do not exceed 3 months. We also propose in the rule to prohibit shorter authorization periods within the 12-month eligibility period. We understand that sometimes these are considered different things in terms of how states implement the program, but did not see that difference in the law and how the law was interpreting what should happen here. So the NPRM clarifies that there's no difference in terms of authorization and eligibility period for 12 months. We also clarify that any additional lead agency eligibility criteria apply only at the time of the initial entrance into the program or at redetermination. So things like looking at child support, enforcement, and other types of conditions that sometimes are added in state policies would only be something that could trigger the state action at when they come into the program and at the time of redetermination. So let's talk more about that time during the initial and subsequent 12-month minimum eligibility periods. What are some of the things that can happen during that time and what can't? So in the NPRM, we have really narrowed that down, because when we were looking at what the law said, it's pretty clear that there are two basic reasons that a family could lose assistance during that time. One is exceeding the federal threshold of 85% of SMI, and the other is this non-temporary change in work, job training, or education status. So families need to notify the lead agency during that time period about those things. But we also propose to limit any requirements for reporting changes to items that impact the child's eligibility, those things listed above, or the lead agency's ability to communicate with parents or providers. For example, if the parent moves, if the family moves, then that information needs to be provided. And then the other bullet, the third bullet we have here, clarifies that if the family has a change in their conditions, for example, their income goes down, we wouldn't want to freeze the ability of a state to lower their copay to support the family during that time period. So we do require lead agencies to allow families the option to report changes at any time during the eligibility period to make changes that would be beneficial to them, such as lowering their copay level. Okay, the next provision is another thing that was added in Congress that I think people have been trying to understand what exactly it ought to mean for some time. And this is providing a graduated phase-out. So Congress had heard a lot about the difficulties families face when they lose their child care assistance suddenly. It's called the cliff effect. I'm sure you're all familiar with that. And took steps and basically sought to make those cliffs much less cliff-like for families, and to really help them sort of work their way out of the program and have some time for making other child care arrangements, because we know families would need that, and if they lose their child care really quickly, then they often end up actually losing their job too. So the law established that, as I said. The NPRM specifies that CCDF lead agencies that establish their income eligibility below 85% of state median income must establish a two-tiered eligibility and set their second tier at 85% of state median income. So at the point that a family comes back in after their minimum 12-month eligibility period and their income has gone above their initial threshold that the state is allowed to set, the lead agency has two options. They can either allow the child to retain eligibility until the family exceeds 85% of state median income, or they can extend assistance for a limited period of time of at least 1 year. The next slide is around provider payment rates. You know, there were a lot of provisions in here in the law around this. Congress became very concerned, had heard from a lot of provider groups about the effect these types of policies around provider rates had on them and their ability to care for children who are in need of care from the subsidy system. And there are several provisions that are clarified now in the NPRM. The law does allow that states can use both of either a valid market rate survey or an alternative methodology to set their provider payment rates, and that they have to take into consideration the cost of providing higher quality care. So now those need to be used to set rates. They must be used to update rates at least every 3 years. And we also have a requirement that states need to look at the base payment rate that they pay and justify that that supports the health, safety, and quality standards that are included in this law. We felt that that made sense given that all these changes are included in the law and that the law has language around the importance of taking into account quality and all the provisions around provider practices, that we felt that made sense. We also have a provision that takes into account the equal access provisions that are in the law. In the law and in previous versions of the reg, the term equal access has been included. What this NPRM does is propose requiring states to set rates that provide parental choice for CCDF families to access care of comparable quality to care available to families with income above 85% of state median income. And we do ask for comment on this. I should have said at the beginning that there are many areas in which we ask specifically for comment. Obviously, you're allowed and encouraged to comment on any number of things that you see in the NPRM, but there are specific things that we do ask for comment on and that we're really challenging to figure out exactly how to address. And there will be a guidepost to those, a guideline for where those are and in what sections they are that we will post online shortly. And then getting back to finish out this slide, many of you are aware that in previous versions of the regulation in the preamble, we talked about how co-payments should be set no higher than a certain amount of family income, and that had originally been pegged at 10% of family income. We are now proposing that the benchmark be lowered to 7%, and this is based on a review of national research looking at the average amount that families are paying for child care and wanting to ensure that low-income families are not being asked to pay a higher amount than the average family. So we are suggesting 7% as a new potential benchmark, and are interested in folks' reactions to that. We also have a provision in here that prohibits charging parents fees above the family co-payment level. So that is something that we have been concerned about. We know that when rates are very low, many states allow the provider to charge a lot of additional fees, but we're really looking at encouraging that the actual base payment level be sufficient enough so that is not necessary, and that the rate that is set in states actually allows for more of an equal access without the need for that additional payment. And we are asking for comment on that as well. Okay, the next page is around improving payment practices with providers. The law has some provisions around this. requiring that payment practices reflect generally accepted practices in the larger child care marketplace. And in the NPRM, we propose that that includes paying on a part-time or full-time basis rather than small increments of time, and paying for mandatory fees, such as registration fees that providers and private paying charge private paying parents. Lead agencies will have the option to provide evidence that such practices are not generally accepted, but those are the standards that we suggest. We also talk about the provision that requires, to the extent practicable, that enrollment and eligibility policies delink provider payments from a child's occasional absence. And so the things in the NPRM we discussed around this are by paying based on enrollment, paying full payment if a child attends at least 85% of the time or misses 5 or fewer days in a month. States may suggest an alternative approach, but the first 3 are the ones that we are suggesting specifically. We also require timely payments for child care services, and that can include prospective payment or paying within 21 days of receiving invoice for services. And we think these things will really help our provider community and provider partners get a leg up, have more stable income, and be able to take CCDF children without worrying that it's going to be a threat to their business, which is not what we want. Next, we also have provisions around building supply that were put in the law. These bullets mostly reflect the way the language was in the law. One thing that I would note that is an addition is that we do require that in order to address this building supply provision, that states use some grants or contracts for direct services. Grants or contracts are a method that can really help really support a provider and encourage providers to come into the system. I have to admit, having done lots of research on this over the years and being a big proponent, I know states around the country are looking at it more too. This is something that will now be required for at least some portion of their subsidy dollars to be used in this manner, as opposed to being distributed solely through the use of vouchers or certificates, which are very hard for a provider to rely on as a source of income. All right, the next bucket or section is around enhancing the quality of childcare in the early childhood workforce. We will move on to the focus on quality improvement. So you're all very aware, I'm sure, that Congress set some new requirements for minimum amounts of spending out of the grant amounts that our grantees receive for quality. So that includes the gradual increases over a 5-year period for the general quality piece, and very exciting, a new 3% infant toddler set aside that's really focused on improving the supply and quality of infant and toddler care. We know our infant and toddler workforce is often the least educated and least well paid, and we're excited about the opportunity to partner with our grantees, and I'm sure you are as well, to really think about the best use of those dollars to promote quality and really look at research-based methods for what's going to change practice and support more providers to take care of infants and toddlers. The other things that we have in the NPRM require states to submit annually the amount of funds reserved for quality activities, the quality activities carried out, and the measures the state will use to evaluate progress. And these are things that are taken basically from the law and are clarified in the NPRM. So if you're a visual learner like me, here's a slide that helps you think about how the quality set-asides will be phased in over time. The FY 2016 has this first time that the quality set-aside goes up to 7%, and next year, FY 2017, is when the infant toddler set-aside starts. So by 2020, we'll be at 12% total. Another very critical piece of improving the quality of care that our children and families are receiving, as you very much are aware of and have been working on for years, is the improvement of training and professional development. And the law does have some provisions around this that we further address in the NPRM. One thing is around that we were really excited to see in the law is a requirement that there be a progression of professional development that states have to basically articulate the process by which our providers can improve their skills in education and training and move up the ladder over time. So this NPRM requires that states have a framework that really articulates the systems that need to be in place for professional development to really make this progression real, especially for our Child Care and Development Fund providers. We want to really think with people about that, and we have been, for years talking about and looking to this research saying that these sort of one-off workshops don't really result in the kind of changes that we want to see or the building of skills and credentials over time that are really necessary for our field to continue to professionalize. So we're excited about this provision and plan to do more work on it over the next year. We also have in the NPRM the provisions that were in the law around requiring both caregivers, teachers, and directors working for CCDF providers to receive these pre-service orientation and ongoing training that is based in the health and safety topics and child development, but is ongoing, so it builds upon that, certainly enriches the provider over time. We don't want folks taking the same thing every year. We want them to have an opportunity to grow their skills. And last but not least, we have a provision that requires that, to the extent practicable, training and professional development yield continuing education units or college credits. Okay, so the next provision is around tribes. The Child Care and Development Block Grant Act, as you know, applies many provisions to states and territories, but is not explicit about how those provisions would work with tribes. And we spent a lot of time talking with tribes and having consultations around the last year around these issues and how they should apply. The NPRM is now going to propose 3 tiers of tribal grantees that is based on the size of their allocation. Right now we have tribes that receive allocations that could be as little as $30,000 a year, and there's no reason why that type of allocation should have the same level of requirements and provision of information to us as tribes with much larger allocations, over $1 million. And you can see from our smaller bullets here that we divided them into 3 areas: large allocation, medium allocation, and small allocation. And these are the numbers that we're using and we're proposing as a ways to divide up the requirements. So tribes will have some of the same provisions that are included that I just went over with you, but they will apply differently depending on the allocation level of that tribal grantee. Temporary waivers and extensions. So the law actually included for the first time this type of provision, and HHS may approve upon review 2 types of waivers and extensions for provisions or penalties in the law. We have clarified that those would include either the transitional extensions that are needed to come into compliance with the law. These are temporary extensions, and those would be things around duplicative requirements that need to be addressed, or extended periods of time in order for a state legislature to enact legislation. The second category is for temporary waivers under extraordinary circumstances, such as a national disaster or a major financial crisis. Waivers will provide temporary time-limited extensions. So there will be an initial period that they may apply for and perhaps 1 extension, but they do not fully excuse any grantee from eventually coming into compliance with the provisions of the law. Okay, so the next thing I want to go over with you is how does this all relate to our CCDF plan preprint process? You're probably very aware that we released the preprint, final preprint yesterday, and that is something that our state administrators and territory administrators now have in their hot little inboxes, in their email inboxes. They have until March 1st to submit what are now 3-year plans, and our e-submission site will be updated, and folks will receive an email in the states when it does become live. Our CCDF plan preprint looks really different than it did before. Not only is it a 3-year plan, but it includes a lot of places where the states and territories can talk about how they plan to implement and come into compliance with things that they cannot say they have done at the time of submitting their plan. And this is purposeful. We really want our states and territories to tell us exactly where they are, and we have now also, as I will talk about in a later slide, we have clarified in the program instruction that goes with this plan that if they are planning to submit a waiver on provisions related to the 2016 deadlines, then those must be submitted by March 1st as well. We think it will be really important for us to be able to look at the waiver and the rationales for the waiver extension. At the same time, we're looking at their implementation plans. It's really critical that the plans reflect what the state's reasonable interpretation of the law is and where they actually are in sort of implementing that, as well as that we have some good faith evidence that they've been working towards implementation but have decided that they need more time. So that will be, those two pieces will be aligned in timing. So if those of you who don't know it, we have some information on our website around when state plans are out for public comment. A lot of states are already out there already. And we thank ECEC, which I'm now
the Early Care and Education Consortium.
Early Care and Education Consortium. There's so many E's and C's in our field. Has on their website, they're collecting in real time, I think, and posting this information because it's such this. I mean, I think it's like this is such an important time for everybody to get involved and partnering with their state and helping make their plans the best they can possibly be. So we do encourage you to get involved in that process if you aren't already. So let's see, where am I here? State and territory implementation plans, there we go. So I think I already said this, but once the requirements, once a state or territory gets to the point where they know they've actually met a requirement, they will have to submit an amendment. And implementation plans really should reflect any intent to request a waiver extension. All right, I think I did say that. So let's go to dates. The CCDBG Act has specific dates, as we've gone over in this webinar. And so that means that those are the dates that states are keeping in mind as they're thinking about submitting their plans and as they're thinking about deciding whether they need an extension. The next slide shows the implementation timeline for the new law and tries to show the journey we are all on together toward implementation since the Act passed November 2014. Next, the plans are due March. Tribal plans will be due July 2016. We will have, and now you can add that waivers for waiver extension requests for March for the 2016 deadlines must also be submitted by this March 2016 date. We have 90 days to review those, so they need to be in effect by June 2016. You can then see in the second line the effective dates we've talked about and the specific ones for the different provisions and the set-asides and how they will kick in over time. If you'd like to think about it in a different visual way, we have this chart, which we had released before in a previous PI, I think last January, that shows the compliance timelines for the specific provisions, and these are all straight from the law. So next I'm going to turn to the comment process, and let me just quickly say, we have 5 minutes left? Okay. So for the comment process, I think Shannon did an excellent job at the beginning to help frame both how important the comment process is and how important it is for you to be really strategic in the comments that you are submitting. Obviously, we like them early, and if you remember the vote early and often adage that's from a city I won't mention, we're going to say early and not often. So we would love to have your comments as soon as possible. It's better for them to be consolidated and for a lot of folks to sign on to one than to have a lot of folks send in a form letter that's essentially similar but requires a lot more work on the part of our staff to process and understand, and will make it much more difficult for us to do this incredible. This is a great team, but we're really a little concerned about getting through all this comment process and getting this done by the end of the summer of 2016, which I know we all want to happen. So you may submit your comments to these sites, this site. We prefer them electronically. You may also mail them, but it's better to do them electronically. Our next slide talks about the ways in which you can help us process this as quickly as possible, please be as specific as possible by citing the page number that you're talking about, identifying the column, and citing the relevant paragraph or section from the Federal Register document. That will be so helpful. As Shannon said, tell us what you like and what you would love to see stay in the NPRM, in addition to the things that you would like to see us tweak. So all comments received are part of the public record and will be posted for public viewing. That means your personal identifying information will be publicly accessible. Don't submit confidential information. We do accept anonymous comments. You have to if you want to remain anonymous, enter a not applicable in the required field. Okay, so we have come to the end of our prepared remarks. I do want to let you know that this is a ton of information. We recognize that. We were planning some topic-specific webinars in January that will focus in on things like the health and safety provisions and give us a little more time to unpack what's in the NPRM in depth. And we also have links here to our technical assistance resources, which we update as often as we have resources available, and the reauthorization policies page, which will be the place to look for the many documents that we are preparing. We have summaries, we have summaries of the provisions overall, we have summaries of the tribal provisions, and other pieces of information like the chart that will help you locate where we've specifically asked for comments. Those will all be available on our website. Do we have any clarifying questions that we should address now? Okay. So first we have a question that says, so in a license-exempt home, every adult that is not providing care must have a background check if they reside in the home. Yes, that is what we are proposing. We are specifically inviting comment in that area and look forward to your take on that issue. Another question we received is the state the place to work on the licensing appeals process, or should we include these comments at the federal level as well? So the answer is we have not proposed anything in the NPRM relating to licensing appeal processes beyond what's in the law, though the NPRM does address appeals related to background checks. We would welcome any comments if you think they are relevant. Another question that we received that we think we can answer right off the bat is that there were a few questions I guess we received on whether we will offer waivers on specific requirements. And the answer is the state can request and HHS will consider temporary extensions for any provision in the law as long as they meet the parameters in the law. For example, they will have to show that they need more time for the state legislature to act, or that they face extraordinary circumstances such as a natural disaster or financial crisis. We do want to remind you that any questions that you have sent to us here through our chat box, we very much appreciate them, and we will use them to help inform what we do for our topical webinars in January. However, they do not substitute for an official comment being submitted.
We'll also remind everyone that the webinar and the slides will be available in early January. We'll make sure to send out an email to everyone who registered for this webinar when it's available online.
Okay. All right, and one thing staff want to remind me I didn't get to in the answer about the waivers is that we are not able to waive state matching requirements. So when we talk about the provisions in the law, we mean those other ones that I just spent an hour talking to you about. Okay, so thank you, everybody. It's great to share all this information with you. We look forward to your comments. We hope you have fantastic breaks over the winter holidays and New Year, and look forward to speaking with you again in the new year and getting your comments. So thank you very much. Thank you for everything you do for children and families, for all the advocacy folks have done out there that have helped us get us this far, and we look forward to continuing to partner with you in the next year. So thank you and have a great day.